guys, it's me, Professor D, and welcome back to my channel. On this video, guys, I'm going to be covering medical surgical nursing topics. These are the important concepts you're going to see on major exams such as NCLEX, ATI, HESI, midterm, final. So it's going to be a group of diseases, disorders, nursing intervention, teachings, you name it, I'm going to cover it. So guys, before we get started, if you haven't done so already, please don't forget to like and subscribe below. My audio lessons are now available on my website, www.nexusnursinginstitute.com. I have extra questions that I practice with you on TikTok and Instagram, so make sure you check that out. My handle is still the same, Nexus Nursing. And I also have a podcast. I have a podcast every Sunday, 1 p.m. 2 podcasts are published, one for LPN and RN students and one for nurse practitioner students. I'm on all the major platforms. There's about 12 or 13 of them. I don't have the list right now, but I know Spotify. That's the only one I can think of, but I'm on like 15 platforms, and they're also on my website as well. So if you check nexusnursinginstitute.com, you can listen to my podcast on there as well. So if you really want to just submerge yourself into nursing and the contents and important things that you need to know for testing, check out my website, nexusnursinginstitute.com. Okay, guys, without any further ado, let's get started. First question. The client asked the clinic nurse if he should take 2,000 milligrams of vitamin C a day to prevent getting a cold. On which scientific rationale should the nurse base the response? 1. Vitamin C in this dosage will help cure the common cold. 2. This vitamin must be taken with echinacea to be effective. 3. This dose of vitamin C is not high enough to help prevent colds. Or 4. Mega doses of vitamin C may cause crystals to form in the urine. And guys, the correct answer is 4. Mega doses of vitamin C may cause crystals to form in the urine. So guys, the normal dosage is about 75, 90 tops. This person wants to take 2,000 milligrams. So what happens, exactly what number 4 says. Excuse me, guys. Crystals can form and the patient can end up getting kidney stones. So we don't want that to happen. So the correct answer for that is number 4. Now let's look at our wrong answer choices. 1, vitamin C in this dosage will help cure the common cold. Excuse me, there is no cure for the common cold. The common cold is a what? Virus. Are there cures for viruses? No. This is a viral infection. It has to run its course. Now, when it comes to viral infections, you can treat the symptoms that accompany the disease or disorder, but you can't cure it. It's a virus, so that's false. 2, this vitamin must be taken with echinacea to be effective. Vitamin C doesn't need to be taken with anything to be effective, so that's false. 3, this dose of vitamin C is not high enough. Excuse me, it's way too high. That's why it can cause the patient to get kidney stones, and so number 4 is the correct answer. Next question. The client recently had an MI. Which medication should the nurse anticipate the healthcare provider recommending to prevent another heart attack? 1, vitamin K and NSAIDs. 2, vitamin E and daily dose aspirin. 3, vitamin A and anticoagulant. Or 4, vitamin B complex and iron supplement. And guys, the correct answer is vitamin E and daily low dose aspirin. Why? So vitamin E, guys, it's an antioxidant that helps prevent and treat coronary artery disease. And low dose aspirin, you guys know what that is. It's antiplatelet to prevent clots. So that's the correct answer. Now let's look at our other choices, guys. We have 1, vitamin K, which helps prevent clots, but look at the rest of it. Vitamin K and NSAID. NSAIDs are for inflammatory disorders. Choice 3, vitamin A. Vitamin A is good for the eyes, the gum, teeth, and the other part of that, let me see, an anticoagulant. So the anticoagulant, that's fine. It helps decrease the risk for clots, but not the vitamin A part. And number 4, vitamin B complex, which is good for the central nervous system, red blood cells, and iron supplement. Iron supplement would be given for somebody with iron deficiency anemia. So that's why number 2 is the correct answer, because both of those choices will help with the prevention of another occurrence. You guys have to be very careful. Guys, I'm sorry. I'm in my studio. My nose always runs, and I have no idea what it is in here that makes my nose run. I don't know. So, but anyway, You guys have to be very careful when it comes to answer choices, because test writers love to do this. They'll start out with a good answer and they'll put the word and, or they'll put a comma, and everything behind it's wrong. Or it'll be wrong in the beginning and right at the end. And that's meant to confuse you, okay? If the whole thing does not pertain to your question, is not correct, the whole thing is wrong. Next question. The client diagnosed with essential hypertension calls the clinic and tells the nurse she needs something for the flu. Which information should the nurse tell the client? One, over-the-counter medications for the flu should not be taken because of your hypertension. 2, if over-the-counter medications do not relieve symptoms within 3 days, call the doctor. 3, tell the client to ask the pharmacist to recommend an over-the-counter medication for the flu. Or 4, make an appointment for the client to receive the influenza vaccine. And guys, the correct answer is 1. Over-the-counter medications for the flu should not be taken because of your hypertension. Why? Over-the-counter decongestants cause vasoconstriction. What does vasoconstriction do? It causes the blood pressure to go up, because remember, what is blood pressure? It's the pressure that's being pushed against the vessel walls. So if the vessel walls are not stretching, if there's vasoconstriction, or there's too much fluid blood, turbulent flow pushing against the vessel walls, all of those will bring up the blood pressure. So that's why that patient with hypertension should not be taking those over-the-counter decongestants, okay? And by the way, the flu is a viral infection. It has to run its course, okay? Let's look at our other choices. Choices 2 and 3 are wrong because we don't want the patient taking any over-the-counter medications. And number 4, make an appointment to receive your flu vaccine. Well, it's a little bit too late for that. The patient has the flu. That's a good idea to teach them for next season, but it's too late now. That's not going to help the patient right now with the flu that they currently have. Which laboratory test should the nurse monitor for the client receiving IV steroid solumedrol? 1, potassium level. 2, sputum culture and sensitivity. 3, glucose level or floor. Or 4, arterial blood gases. And guys, the correct answer is 3, glucose level. So I talk to you guys about this all the time. If you've been following me for any amount of time, you know this. When it comes to corticosteroids, you have 4 major concerns. 1 is hyperglycemia because they're full of sugar. 2 are stomach ulcers because they're very hard on the stomach. 3, what's my third one? Infection, because they mask the signs of infection by decreasing inflammation. And the 4th concern is osteoporosis, porous bones. Patients that are taking corticosteroids for an extensive amount of time, those are our top 4 concerns. The client diagnosed with asthma is prescribed the mast cell inhibitor cromolyn. Which statement by the client indicates a need for further teaching? 1, I'll take 2 puffs of my inhaler before I exercise. 2, I'll rinse my mouth with water after taking the medication. 3, after inhaling the medication, I'll hold my breath for 10 seconds. 4, when I start to wheeze, I'll use my inhaler immediately. And guys, the correct answer is 4, when I start to wheeze, I will use my inhaler immediately. So this question's asking us which one needs further teaching. In other words, which one is the wrong answer choice. And number 4 is the wrong answer choice. If that patient starts wheezing, they need to be taking a SABA, a short-acting bronchoagonist, such as what? Albuterol, okay? Now, if this patient's wheezing, those mast cells are not stabilized, so that's not the time to be taking, because it's not going to do anything for the patient. They need to be taking a short-acting bronchoagonist. They need something that's going to open up those airways immediately. All the other choices are good. The client diagnosed with MRSA is receiving the aminoglycoside antibiotic vancomycin. A peak and trough level is ordered for the dose the nurse is administering. Which priority intervention should the nurse implement? 1, ask the client if he has had any diarrhea. 2, monitor the aminoglycoside peak level. 3, determine if the trough level's been drawn. Or 4, check the client's culture and sensitivity report. And guys, the correct answer is 3, determine if the trough level has been drawn. Why? Because we need that information before we give the antibiotic. If that trough level is too low, what do we have to do? Call the doctor. Let's look at our other choices. 1, has the client had any diarrhea? That's not a priority at this time. We can ask that. That's a good assessment, but that's not our priority before giving the medication. 2, monitor the aminoglycoside peak level. Well, we do need the peak level, but we're not checking that peak level until an hour after this medication's been infused. So that's not going to be the first thing that we do. And 4, check the client's culture and sensitivity report. Well, that was already done. That's how the doctor knew what kind of antibiotic to order for the patient. So the correct answer would be number 3. The nurse is caring for an elderly client who's 8 hours post-op hip replacement and reporting incisional pain. Which intervention is priority for this client? 1, assist the client to sit in the bedside chair. 2, initiate pain medication at the lowest dose. 3, assess the client's pupil size and accommodation. Or 4, monitor the client's urinary output hourly. And guys, the correct answer is 2, initiate pain medication at lowest dose. You're going to give that patient the pain med as ordered. They just got out of surgery. They're having incisional pain. You're going to give that med as ordered. And guys, here's another tip. When you see a choice, if it's on there, you have to assume that it's been ordered. You don't have to, it doesn't have to say ordered by the physician. If it's a choice, it was ordered, okay? Now, let's go look at our other choices to see why they're wrong. 1, assist the client to sit in the bedside chair. So, what kind of surgery did this patient just had? Hip surgery. Are we going to be having them sit up in the chair where their hips are at a 90-degree angle? No, that's wrong. Number 1 and number 2, they just had surgery. They're going to be lying down in bed. So that's wrong. Number 3, assess the client's pupil size and accommodation. They had hip surgery. Why are we doing neural check? What does that have to do with the patient's pain for the hip surgery? So that's wrong. Choice 4, monitor the client's urinary output hourly. That's wonderful. They just had surgery. You want to make sure patient's not internally bleeding, going into shock, all that good stuff. Wonderful. But what does that have to do with the pain that the patient has post-surgery? It doesn't address it. So that's wrong. The correct answer is to give them the pain at the lowest, give them the pain medication at the lowest dose. Oh. The client's diagnosed with pernicious anemia. Which healthcare provider order should the nurse anticipate in treating this condition? 1, sub-Q iron. 3, IM B12. I can't speak, guys. 1, sub-Q iron. 2, IM B12. 3, IV folic acid. Or 4, oral thiamine medication. And guys, the correct answer is 2, B12. So what's happening in pernicious anemia? The patient doesn't have intrinsic factor. Where's intrinsic factor found? In the stomach. Why is intrinsic factor important? That's what helps you absorb vitamin B12. So if they don't have the intrinsic factor, they're not absorbing vitamin B12. They're not absorbing vitamin B12. That places them to have what? Pernicious anemia. So that's why we're going to replace that vitamin B12 IM. By the way, patients that have pernicious anemia, they have to get that vitamin B12 IM every single month. If they stop, they will die. You need vitamin B12 to live, okay? Before they die, they're gonna start having CNS disturbances, but they'll eventually die without that vitamin B12 being replaced. They're gonna have to take vitamin B12 for the rest of their lives, or their life is not gonna be very long. Now let's look at our other choices. 1, sub-Q iron. Well, we give that for iron deficiency anemia. 3, IV folic acid. We give that to patients who have folic acid deficiencies. By the way, we tend to see folic acid deficiency in what type of patients? Alcoholics. And 4, oral thiamine medication. This thiamine med, this is used in detox for what type of patients? Alcoholics. The client with type 2 diabetes is prescribed glyburide of sulfonylurea. Which statement indicates the client understands the medication teaching? 1, I should carry some hard candy when I go walking. 2, I must take my insulin injection every morning. 3, there are no side effects that I need to worry about. Or 4, this medication will make my muscles absorb insulin. And guys, the correct answer is 1, I should carry some hard candy when I go walking. So here's what a sulfonylurea is, guys. A sulfonylurea is an oral hypoglycemic agent. So it's not something that's injected. It's something that the patient takes by mouth. Now, in order for this to work, the patient who's taking the sulfonylurea, they have to be a type 2 diabetic. They cannot be a type 1. And here's why. The action of sulfonylurea is that it stimulates the pancreas to shoot out more insulin. Patients with type 1, that pancreas is dead. It's not shooting out any insulin. And if it is shooting out a little bit of insulin, it's nowhere near enough of what the patient needs to survive. That's why type 1 diabetics are called insulin dependent, okay? That pancreas is dead. So if you give a sulfonylurea to a type 1, that patient's going to die because that sulfonylurea is not going to do anything for that type 1 diabetic. Sulfonylureas are given to patients with type 2 that the pancreas just needs a little push. So what the sulfonylurea does is say, hey, pancreas, wake up. It's time to shoot out more insulin, okay? So number 1's the correct answer because we know if the patient takes a sulfonylurea as a type 2 diabetic, the pancreas is going to start shooting out more insulin and the patient's blood sugar might drop, especially if they're walking, especially if they're exercising. So it makes sense to carry hard candy, some form of glucose, because they expect that that blood glucose can potentially drop. Number 1's the correct answer. Now let's look at the wrong answer choices. 2, I must take my insulin injection every morning. I just explained to you what a sulfonylurea is, so you know that's wrong. 3, there are no side effects I need to worry about. Yes, there is. What do sulfonylureas do? They cause the pancreas to shoot out more insulin. The blood glucose can drop. Excuse me. So something we're concerned about is hypoglycemia. And choice 4, this medication will make my muscles absorb insulin. No, it doesn't. I just told you how it works. So we know the correct answer is number 1. The nursing assistant reports that the client's glucometer reading is 380. The client is on regular sliding insulin that reads, and guys, you can take a look at this sliding scale. And the question asks, how much insulin should the nurse administer to the clients? Well, if you look at the sliding scale, you see between 351 and 450, the patient's going to get what? 10. So the correct answer is 10 units of insulin. The nurse administers 18 units of Humulin and an intermediate acting insulin at 1630. Which priority intervention should the nurse implement? 1, monitor the client's hemoglobin A1C. 2, make sure the client eats an evening meal. 3, check the before meal blood glucometer reading. Or 4, ensure the client eats a snack. And guys, the correct answer is 4, ensure the client eats a snack. So here's why. If you go back to the question, we see that the patient's getting an intermediate acting insulin and they're getting it at 1630, which is 4:30 in the evening. Well, the peak of those intermediate acting insulins is what? 6 to 8 hours. Remember, the peak of insulin is when we expect the blood sugar to be the lowest. That's the most dangerous time. So we want the patient to have what during that time? A snack. We don't want that patient to bottom out on us. And so number 4 is the correct answer. Let's look at our wrong answer choices. Number 1, the hemoglobin A1C. Guys, the hemoglobin A1C gives us a clinical picture of what the patient's blood glucose has looked like for the past 3 months, for the past 90 days. That has nothing to do with this intermediate acting insulin that the patient's taking right now. Choice 2, make sure the patient eats the evening meal. Well, they just got it at 4:30. Evening meal is going to be around 6:30, 7 o'clock. That's still too early. We're worried about the peak time. And choice 3, check the before meal blood glucometer reading. That's not priority over patient getting a snack during the peak time. The nurse is administering the following 1,800 medications. Which medication should the nurse question before administering? 1, sliding scale insulin to the client who's just been released to have evening meal. 2, the antibiotic to the client who's 1 day post-op exploratory abdominal surgery. 3, metformin glucophage, a biguanide to client having a CT scan in the morning. Or 4, Protonix, a PPI to the client diagnosed with peptic ulcer disease. And guys, the correct answer is 3, metformin, a biguanide to the client having CT scan in the morning. In the morning. So the question asks us, let me go back to question. It says, which medication would you question? What they're saying is which one's the wrong answer choice. And it's number 3, the biguanide. Biguanides have to be held 24 to 48 hours before the patient gets any type of contrast media. Why? It's so hard on the kidneys. It can actually put the patient into kidney failure. So we're going to hold that biguanide 24 hours to 48 hours before they get that contrast media. And then when they do get the contrast media, after the patient has a CT scan, we're going to do what? Flush those kidneys. That patient's going to get IV normal salines. We want to flush those kidneys out so it doesn't give too much of a hit to the kidneys. So the correct answer is number 3. The nurse is administering the long-acting insulin Atlantis to the client at 2200 hours. The nurse asks the charge nurse to check the dosage. Which action should the charge nurse implement? 1, ask the nurse why the insulin is being given late. 2, check the MAR with the dosage in the syringe. 3, instruct the nurse to complete a medication error form. Or 4, have the nurse notify the doctor. And guys, the correct answer is 3, check the MAR with the dosage in the syringe. You want to double check the dosage against the MAR. That's exactly what you want to do. Double check that dosage that you have, that you're looking at, against the MAR, against what is ordered. The nurse is preparing to administer Synthroid, a thyroid hormone replacement, to the client diagnosed with hypothyroidism. Which assessment data would indicate the client is receiving too much medication? 1, bradypnea and weight gain. 2, lethargy and hypotension. 3, irritability and tachycardia. Or 4, normothermia and constipation. And guys, the correct answer is 3, irritability and tachycardia. So guys, whenever a patient's getting a medication, you're going to have some concerns. 1, are there going to be any adverse reactions or side effects? 2, is going to be the indication why we're giving the med. And 3, what happens if that medication works a little bit too well? Whenever you guys are being questioned about medications, they're usually 90% of the time asking you about one of those 3 things that I just mentioned. So in this question about that patient that has hypothyroidism and they're getting Synthroid, what would be a concern? That medication working a little bit too well. And so it throws them into what? Signs and symptoms of hyperthyroidism, which is number 3, irritability and tachycardia. Number 1, bradypnea and weight gain. Number 2, lethargy and hypotension. Number 4, normothermia and constipation. All of those are signs that the patient is not getting enough of the Synthroid, because those are signs and symptoms of what? Hypothyroidism. Okay, so number 3 is the correct answer. The client with postmenopausal osteoporosis is prescribed the biphosphonate Fosamax. Which discharge instructions should the nurse discuss with the client? 1, the medication must be taken with breakfast meals only. 2, remain upright for at least 30 minutes after taking the medication. 3, the tablet should be chewed thoroughly before swallowing. 4, stress the importance of having monthly hormone levels. And guys, the correct answer is 2, remain upright for at least 30 minutes after taking the medication. Guys, this medication is very, very, very irritating, and it can cause gastritis if the patient lies down and that medication creeps up to the esophagus. So we want that patient to be sitting upright for at least 30 minutes. We want the patient to take that medication with a full glass of water, at least 8 ounces. And we want that patient to take this medication on an empty stomach. So they're going to take it in the morning before they have any breakfast. Okay, so the correct answer is number 2. The nurse is administering morning medications. Which medication should the nurse administer first? 1, daily digoxin to the client diagnosed with CHF. 2, loop diuretic to a client with serum potassium of 3.1. 3, mucosal barrier carafate to the client diagnosed with peptic ulcer disease. Or 4, Solumedrol IV push to a client diagnosed with chronic lung disease. And guys, the correct answer is 3, mucosal barrier carafate to the client diagnosed with peptic ulcer disease. So this patient has a peptic ulcer. What does carafate do? Carafate lines the mucosa, the GI mucosa. So guess what? The carafate has to be given before the patient eats, because the carafate is going to be the barrier for the stomach lining. That mucosa is what's going to protect that stomach lining from the hydrochloric acid that the stomach is producing and burning more holes through it, right? So this is why you're going to go to this patient first, because this patient absolutely must have that carafate before they can have any food. And guys, we are already down to our last question. The client's receiving an ACE inhibitor, Zestro. When would the nurse question administering this medication? 1, the client is not receiving potassium supplements. 2, the client complains of persistent irritating cough. 3, the client's blood pressure for 2 consecutive readings is 110/70. Or 4, the client's urinary output is 400 ml for the last 8 hours. By the way, this is a famous nursing test question. You guys have to know this concept, guys. And the correct answer is 2, the client complains of a persistent irritating cough. This is an adverse effect that must be reported immediately. There are so many other great meds on the market that if that patient develops the irritating cough, we want to know immediately so the doctor can switch the medication. Because what's going to happen if we don't warn the patient, excuse me, if you develop a cough, let us know and the doctor will change it. If you don't tell them that, many patients just assume that that's just how the medication is, and they don't want to live with a cough for the rest of their lives, and they stop taking their blood pressure med. Then what happens? They mess around and have a stroke. So you have to teach them in advance, hey, you know, an irritating cough and developing a cough, that's an adverse reaction. Please let us know if it happens, and the doctor will switch medication. So you definitely going to teach them to report that right away. Guys, I hope you found this video to be helpful. Every single question I covered, these are contents that you do see on big exams such as the NCLEX, ATI, HESI, your midterm final. These are important concepts that you definitely need to understand. And all of these concepts that I covered, I've done a whole video on every single one of these concepts that I covered. So if there's anything that I went over that you may not understand or you want to cover more in depth, go check out my playlist. And I break it down by a body system and watch the whole video. My videos are usually about 25 to 30 minutes long. Guys, please don't forget my podcasts are available on my website, nexusnursinginstitute.com. My audio lessons, if you're struggling in the nursing program and you need help, you need me to break things down to you, and more importantly, point out to you what you're most likely going to get on your exams, check out my website, nexusnursinginstitute.com. And also, please don't forget, I'm also on TikTok and Instagram. Please don't forget to like and subscribe below and to share my content with anyone that you think would benefit from my videos. Thank you so much for sharing this time with me, and you'll be seeing me on my next video.